Well, how does type 2 diabetes impact heart health? Merritt Bates-Thomas is back with some guidance on that important topic. Good to see you. Welcome back from your trip.
Thank you. It's good to be back.
Oh, yes, she is all smiles and ready to tell us what's wrong with us. So there's some stuff wrong with us.
No. What we can do to keep ourselves healthy, or as healthy as we possibly can be.
Right.
And I think the key implications with our hearts is that our vascular system runs throughout our body. When we think of heart disease, we think of the heart. But because of that vascular system, we're looking at not just lipids, we're also looking at blood pressure too.
All of it is a big picture, isn't it?
So we're thinking coronary artery disease or heart disease. We're thinking cerebrovascular disease, which is going to tie in and impact the brain. Then we're thinking peripheral artery disease, which has implications down into our legs. So all of these things are important. Everything we've been talking about in the previous episodes, the topics other guests cover, they're so vitally important to keeping ourselves active and physically active, to eating healthy, but balancing those food choices, that's the key thing. It isn't about an all or nothing concept.
And I think people feel like that. Oh, well, I'll never have anything wonderful again. And
so
that's not,
throw your hands up
Right.
and just resign yourself to the fact that you can't achieve something. When in reality, it's really the only thing you're competing with, the only person you're competing with is yourself. It's about your personal best.
I needed to hear that today, Merritt, in so many ways. So you've brought some things to demonstrate how we're doing. So what is this little?
So these are
wands?
What we call diabetes sticks.
Okay.
So this one, and Angie, if you want to wave it.
I can.
Yes.
I can. It's okay.
So that one is a normal blood sugar, a representation of a normal blood sugar.
Okay, it's moving through there.
It's moving through there. So you can see the sugar running through or moving through the bloodstream.
What it's supposed to do.
This one is an elevated A1C. It's like an 8. So normal range is normal range is below 5.7. Pre-diabetes is 5.7 to 6.4. This is an 8.
This is an 8.
That's
so what
an
is
8.
it when it's like this? What is this saying to us? That our blood is what?
Well, it's thicker. And then long range, it can contribute to the development. And I've got two views here. One might show better on the camera or on the screen, but you have the clear artery and the clear artery here. You have very minimal, what they call striations along the artery walls in that second one. You have the beginning buildup of the plaque here with some blockage, and if a large clot, were to come along or get lumped in there, that could be the beginnings of trouble. Then you have a pretty good occlusion there.
Right. So
and then this one shows a pretty significant blockage in this last piece.
Can we undo it, or what do we do if we find that we have some blockages from a heart cath or whatever? Can it be undone?
It can be reversed to a degree. I think, again, it's individualized. And the key thing, first of all, working at prevention and jumping in where you're starting. Prevent from the point you got something.
Right.
But so much easier to work around preventing heart disease from developing and possibly delaying or preventing the onset of diabetes as well.
Thank you so much. Great visuals. We'll be back with more. Stay with us.